Hey guys, wanted to get the exam review out to you. Just gonna apologize in advance. I have my 7-year-old here playing in the background. Everybody in my house is sick. I did convince my daughter to take the dogs because I had already tried to record the review, and in the first minute and a half, her dog walked around the room, tore apart a piece of candy wrapper that was on the floor, and then found a piece of bubble gum and decided to chew that, which, yeah, it was like a cartoon. And then she walked over to her food dish, picked some up, and spun around and threw it all over the floor. So I did convince Bailey to come get her stupid dog. Um, so you might just hear Bailey play, or Ari playing with her arts and crafts stuff in the background, or she may forget and say something here and there, but I'll just quiet her down. Alright, Healthy People 2020. This is where they feel that individual health is related to community health, and community health is related to individual health. This being said, basically, you can't have a healthy community without healthy individuals, and you can't have healthy individuals without a healthy community. So, the goals of the Healthy People 2020, they want everyone to attain high quality. And that dog's trying to get in again. Ugh, I quit. My door's closed and she can't get in, so haha. Alright. Goals of Healthy People 2020. They want everyone to attain high quality, longer lives, where we're able to prevent disease, disability, injury, and any premature death. They want everyone to achieve health equity, eliminate disparities, improve health of all the groups. They want to, I don't know. What are you into? I have no idea. What is that? Is that nerds? Did you put nerds in your... Oh my god. Alright guys, I'm gonna restart over. My daughter was putting nerds in her Play-Doh and now it looks terrible. It looks kind of scary. Okay. Restart. Healthy People 2020. Individual health is related to community health. Community health is related to individual health. Goals, they want everyone to attain higher quality, longer lives, where disease, disability, injury, and premature death are all preventable and prevented. They want everyone to achieve health equity, so that there aren't any disparities, and all groups actually have improved health. They want to create a social, or they want to create several. The environment, they want to make it socially and physically, so that they're promoting good health for everyone in those environments. And then they want to promote a higher quality of life, health development, and healthy behaviors across the lifespan. And that's going from infant on up to 120 years old, or however long the oldest person is. Anyways, it goes from birth all the way on up through the lifespan. The vision is just a kind of summarized version of the goals. Healthy People 2020 want a society where all people live long, healthy lives. So getting into some definitions here. Health promotion. Health promotion is just a behavior motivated by a person's desire to increase their well-being and increase their human potential. Health prevention or protection is a behavior that is motivated by... Okay, you need to sit. Otherwise, you're going to go out. Okay. Health prevention or protection is a behavior motivated by a desire to avoid illness, detect illness early, or maintain functioning within the illness or the disease. So I want to get down in here to... Where the heck did I go? primary, secondary, and tertiary. So primary prevention, which is the health prevention or the behavior. If you learn I'm going to go back and forth so you can look. If you learn the health prevention definition as a behavior motivated by a desire to avoid illness, detect it early, or maintain functioning, that is in the exact order that the primary, secondary, and tertiary is in, or what exactly it is. So primary is anytime a person is actively avoiding any illness. They are decreasing their risk or decreasing their exposure to this illness. An example would be like getting an immunization. So somebody might get the chickenpox vaccination at a young age because then they are decreasing their risk of getting the chickenpox, or I should say the severity of chickenpox. Or when they're older, the shingles vaccine, which is pretty much the same thing. So that they're protecting themselves against shingles. And that's primary prevention. Secondary prevention, they focus on early detection of an illness. Remember I used the example, a person is detecting their rheumatoid arthritis at an early stage before they have all of these deformities. Maybe they are having pain in a joint that's on one side. And so they go in to have it looked at, find out they have rheumatoid arthritis. So then they're going to take interventions that are based on alleviating all the health problems that are linked to rheumatoid arthritis. So they might be on methotrexate, or they might be on another immunosuppressant, or something so that their body's not attacking itself, causing more deformities. So that's basically what they're doing, is trying to prevent later injuries, disabilities, and keeping them at a minimum. So tertiary prevention, remember if we look up here, it's maintain functioning within an illness. They're focusing on restoring the patient, getting them rehab, whether it's PT, OT, speech therapy, so that they can return to their baseline, or if they cannot return to their baseline, say they've got too much residual from a stroke, what can they do so you can get them to their optimal level of functioning with maybe a right-sided weakness. Maybe they need I forget what they're called, like a foot brace, so that their foot doesn't drop due to their stroke, and they have to use a walker. But what can they do so that they are getting back to their highest level of functioning possible? So going back up here, health behavior, it's just what a person does. It's their the actions that they're taking to understand what a health condition, or be at a high level of health, prevent illness, reach their highest potential. So it's just what they do to maintain their primary, secondary, tertiary prevention, if you want to look at it like that. All right. So now that we know that health behavior is the actions that people take to better their health or maintain wellness, the stages that I want to go through, I think there are 6 actually. Yeah, there are 6. Sorry, I'm kind of bouncing around. I really feel terrible tonight, but I wanted to get this out to you. The pre-contemplation stage. This is before they're contemplating it. If you just break down the words, it really helps in nursing. They're not considering making any changes within the next 6 months. They might not talk about it. They might not read about it. They don't even want to think about it because they don't have a problem. This is when they're they're, what's the word I want? Oh my gosh. Participating in a high-risk behavior. I use smoking a lot. Let's use, my Mountain Dew drinking. So, at this point in my life, I'm probably in the pre-contemplation stage. Because I will probably not make any changes to the amount of Mountain Dew I drink, in the next 6 months. I don't want anybody to tell me that I drink too much Mountain Dew. I don't want anybody to tell me that, hey, yeah, there's a lot of issues caused by drinking all the soda. The sugar's not good for me. I might get diabetes, all those things. I don't want, I'm at this point in the pre-contemplation stage, I don't want to hear about it because I don't think there's an issue. Contemplation stage, this is where the person understands that there's an issue. They're starting to gather information, I might discuss plans to make changes within the next 6 months. A lot of people stay in this stage. They say, yeah, I really shouldn't be drinking this much Mountain Dew. Oh, but I'm gonna, every time somebody talks to me, yep, I'm gonna quit. My goal is to start in 6 months. And they talk to me a month later and I said, yep, I'm gonna start in 6 months. They talk to me 2 months later, yep, I'm gonna start in 6 months. So I might get stuck in this stage, but at least in the contemplation stage, I'm understanding that there's an issue. I might begin to do some research onto how much sugar is actually in Mountain Dew. And I might kind of discuss with some people, how did you quit drinking caffeine? Those types of things. Preparation stage. This is where I'm going to plan my behavior change, and it's going to start within the next month or tomorrow, anytime within the immediate future, but for sure within a month. I might have started making like small behavior changes. So anytime I go to the fridge to get a Mountain Dew, I may take out, Quit painting. You need to get that off. Quit, guys, I'm sorry. I might go in and start drinking ginger ale. I might pull a ginger ale out of the fridge because there's less sugar, there's there's no caffeine in it. I totally lost my train of thought, so I don't know how you guys are following me right now. I really apologize. I may have started buying ginger ale to keep in my fridge because what I'm going to do is every time I want a Mountain Dew, I'm going to drink a ginger ale. That's the preparation stage. Action stage, this is where the new behaviors are started, and I'm actually carrying out the plan to quit drinking Mountain Dew. So this is where when I do go to the fridge to get a Mountain Dew, I'm going to pull out a ginger ale instead. Maintenance stage, ginger ale is pretty much stuck into my lifestyle. I may have, a bad day where I go back and have a couple Mountain Dews. You need to stop. I don't know what you're into, but you need to stop. Okay, we're done. If you're going to be in here, you need to be quiet. Deal? I know. So, maintenance stage. This may last 6 months to 5 years. I may have some relapses where I'm drinking a couple Mountain Dews because I had a bad day. But ginger ale is pretty much part of my new life. Termination stage. I have no temptation to go back and drink a Mountain Dew. It is just automatic for me when I want something to drink that I go in the fridge and get a ginger ale. So there is no possible that I'm going to go back. Some people never reach this stage. So if people do, kudos. Alright. Health promotion. What do we do as the nurse? It's good for us to model the behavior and the attitude for our patients, the healthy behavior, the healthy lifestyle. We need to really encourage our patients to be involved in all of their goals, their assessments, the implementation of their goals, not just the part of doing it. So we're not just saying, here, you need to quit drinking Mountain Dew because it's bad for you because you might get diabetes when you're older. We need to say, hey, we understand that you really like your Mountain Dew, but what can we do to help you quit? We need to teach our patients self-care strategies, assist others in meeting their health levels. We need to educate our patients, assist patients, families, and communities to learn how to choose these healthy options, reinforce when individuals or families have healthy behaviors, reinforce that you're proud of them, and advocate in the community for any health changes. Something that goes on in the community that could really make a difference in making a healthier community. Family-centered nursing care. This is where, as nurses, we don't just treat the patient. We are showing an interest or working with the entire family because a family unit, they're the ones that are going to be caring for this person once they're discharged from the hospital or the nursing home or whatever. And that's where this person's support is. So we really need to learn how to look at the patient and their family. We need to remember that when a family member is hospitalized, and we'll get into health crisis later, but family members are stressed out. They just need someone to hear them out, to listen. So I know when my brother was in the hospital, and maybe some of you who are at Gunderson for Lifespan Clinical have actually worked with him on ortho, but Kyle was amazing with me. He listened to me complain and bitch and moan, and he says, okay, Lisa, chill out, you're being irrational. He was like I told Kyle, like, you're my rock, you got me through this. But he was really good to not only take care of Ron, but really, really, really well, but he also took care of me too. So, if you guys see Kyle, he's bald, shaved head, and on ortho. He's a pretty awesome guy. Like I said, care is based on the health of the family as a whole, and each family member. Erikson stages of development, and I did not put the younger ones on here. But we can get into that a little bit later if you guys want. Because we do have nursing care of the child coming up, so it's kind of where I started here at young adults. So young adults, their Erikson stage is intimacy versus isolation. Middle-aged adults, generativity versus stagnation. Older adults, ego integrity versus despair. So what is intimacy versus isolation? I just want to make sure I don't have it down here to go over. Nope. People in this group, the young adults group, the 20 to 40, they're really looking to find a life partner, to start talking about kids, to really get that intimate, forever relationship started, and to start becoming a family. And if they can't master that, then they may be isolated. They may be an old bachelor, or they may be a bachelor, and feel isolated. Middle-aged adults, generativity versus stagnation. Um, generativity is basically they're concerned for the younger generation. They might be a sports coach. They might be a teacher. They might, um, be participating in activities that will better the younger generations. Stagnation, they're bored and they're not doing anything to help the future. So if we just kind of remember they're stagnant, that's kind of how I do it. Older adults, the ego integrity versus despair. They are really looking back and determining if their life, the ego integrity part, is if they're satisfied with their life. They're happy they had kids. They're happy with their career. They're happy with how their children turned out. Versus despair, where they're looking back at their life and really saying, that was really terrible. I wish I could get a go again. You're going to hear this a lot when you take care of older people and when they're starting the dying process. When I first started nursing, I had a hard time with this. Everybody that said, "Oh, I wish I was dead," I literally went to the supervisor and said, "Oh, they're going to hurt themselves." No, that's not the case. We actually have to take a step back and say, "Okay, honey, tell me about it. What's going on?" And they'll tell you. I had a good life. I'm ready to go. My wife is dead. My family's all gone. I'm 107. I don't have anybody left of my family or my friends. And I really, really think that I had a good life. So I'm ready to go. Despair is the same conversation. Maybe I wish I had friends. I wish I would have had a family so I had somebody here with me right now. I'm not ready to go. I need more time. I need something. I need to redo something so that I can feel like I'm very happy and satisfied with my life. So, health risks. And like I said, we're going to have a unit on nursing care of the child. So, I didn't include all those. Young adults. Remember, this is the 20 to 40 age group. Their common health risks are injury or violence, whether they're fighting or driving their car really fast, suicide, hypertension is weird that it's in here because it doesn't seem to fit. It seems like it would be something in the middle of the age adults, but substance abuse may cause some health risks. STIs, because, and I'm not putting this because I'm not stereotyping, but some younger adults, they reach that 21 years of age and they're able to go out in the bar and they will take different people home. And I only say this because even the kids that I've known since they were born, they hit 18, started to go off to college, they're already participating in this, and they're still my favorite kids. But they're at a higher risk for STIs when they are being provocative. They may have eating disorders, especially the younger years, because they're trying to fit in college, or they're stressed out, whether they're eating nothing or they're eating all the time. And they also may have some malignancies going on. A lot of the risks that these these young adults have can actually be prevented if we can educate them, if they're willing to listen to our spiels. Middle-aged adults, they're 40 to 65. Their biggest health risks are related to what they did as young adults in the 20 to 40 age. I don't know if I gave you guys or the other group the example of my dad. My dad was the biggest badass ever. He was literally, I'm trying to think of his name. The Fonz. Maybe he wasn't such a badass, but kind of that type of, popular and James Dean type. Yeah, that's better. Um, he was a James Dean type. He even looked like it. Like, I literally showed my daughter a picture of him, and she's like, "Oh, who's that? He's cute." I was like, "That's your grandpa." But when he was younger, he was a badass. He had the cigarettes rolled up in his sleeve. He always had a cigarette in his mouth. He was drinking. He was driving fast. He was sometimes doing both at the same time. And he actually, he actually quit smoking when he was, let me do the math here real quick, 46. So he's still just out of that young adult group. When he turned 74, I mean, he had COPD and emphysema and all of that for quite some time, as long as I can remember. And it had gotten worse over the last few years. But when he turned 74, New Year's Day, he was actually diagnosed with lung cancer. So it all came back from when he was, being like I said, the badass, because that's what you did in the 50s, came back to bite him when he was in the older adult. Women have a high risk of developing cancers in this group. Lung cancer, breast cancer are the biggest factors. So we need to really start considering screenings, whether they're mammograms, whether they're pap smears, any type of, cancer screenings. Men are at high risk for prostate cancer, and so they need to be screened using a PSA. Oh, I'm using the wrong mouse. I got too many computers up on my desk here. Older adults, their health risks, health problems, are all related to injuries, chronic diseases. They might have a little bit of drug misuse. Sometimes older adults drink quite a bit. Some of their risks might be contributed to dementia or mistreatment. These are older adults. They're over the age of 65. A big injury would be falls. Chronic diseases that are, long-term, that have been going on for a while. Drug misuse. They are older and they don't have the highest health literacy levels. It was not something that they were taught as they were growing up. If they have dementia, they may not have any safety awareness. I had a patient with dementia that I treated, and he had dementia, and his son lived, I don't know if it was just next door, but it was out in the country, so it was a little ways. He went out in the cold in the winter, and he fell. I mean, because of his dementia, he was not wearing the appropriate clothing, the coat, or the coveralls, or whatever, or the right shoes. So when he fell, he actually was unable to get up. And so because he didn't have the proper covering, because he didn't understand that he needed to wear it, he received terrible, terrible, terrible frostbite. I was able to save 8 of his toes. He did have to have 2 taken off. But when he first came to me, I didn't think he was going to leave there with 2 full legs. I thought we were going to amputate both of them. It was terrible. And a lot of times mistreatment, which is more common than we realize. we went over, we kind of went over these, yeah. Young adults, the intimacy versus isolation. They're starting to develop a sense of self, looks for others. They want a loving, intimate relationship. They may choose a life partner, live with their partner, consider starting a family, those types of choices. Middle-aged adults, marriage partners actually have more time for each other because all their kids are grown and out of the house. So they're able to do more things. So whether they've got more time for helping the next generation or they're going to be withdrawn because they are bored and they are not happy with their aging self. Older adults, we went over this, they're satisfied with their life's accomplishments or they're not. Vaccinations for age groups. Flu vaccines are recommended every year for all age groups. Generally now they are saying not before October. Some physicians will say even do not give till the 1st of November because the flu seasons are lasting longer now. A couple years back when I was actually giving all the flu shots for the residents and the employees, we had to really beg to give them the 3rd week of October because that's when we had our in-service. Because the doctor that was ordering them said that the year before they had seen flu cases all the way out, influenza cases all the way out until April or May. So yearly for all age groups. The Tdap get the one initial dose and then get boosters every 10 years. You guys will really see this when you're like in ER and they come in with a cut or a dog bite or something like that. That's the first thing they're gonna ask us. Hey, did you give the tetanus? I know my groups at Mauston have given a few tetanus boosters because of dog bites and injuries. Shingles or the zoster vaccine, they get a dose, one dose, anytime after they're 60. Pneumococcal, they can get the dose beginning at 65, and there's two. There's the pneumococcal, there's a 23, and there's a 13. This is a requirement by the state for patients that live in like nursing home facilities. Most places that are admitting a person from the hospital or from home will require that they have had at least one pneumococcal and that their flu vaccine is up to date. So just a heads up. Health screening, middle-aged adults, obviously a physical exam every year. Recommended immunizations might be the tetanus booster or the influenza. 6 months dental appointments, eye appointments every screening for glaucoma every 2 to 3 years depending on their risk factors. Breast exam annually by the primary care provider. There is, and just kind of a quick side note, there is kind of a question about self-exams. People have found areas when they're doing the self-exam that they become concerned about and they go in for mammograms, they see it, they might need a breast biopsy or whatever. So they're kind of saying that sometimes these self-exams are producing more testing than what's needed because these tests are coming out like a calcium deposit or something like that. And on the male side, the testicular exam by the PCP. They need to be screened for heart diseases. So they get the blood pressure, the EKGs, cholesterol levels checked. Screenings for cancers, the colorectal or the breast or cervical or uterine or prostate. Recommend screening for TB every 2 years. This doesn't happen very often, especially if they don't have a risk for it. So then the older adults, cholesterol levels, LDL, HDL, and total cholesterol every 3 to 5 years. If they have risk factors for diabetes, get them screened every 3 years. Teach them smoking cessation, but if they've lived to be 80 years old, smoking a pack a day since they were 15, once they hit 80, I guess I say, well, do it whatever makes you happy. Mammogram screening for breast cancer every year or two. Pap smears if there's any risk factors, family history, whatever, of uterine cancer, cervical cancer, or whatever. Exams for prostate cancer, the digital rectal exam or PSA. Colonoscopy is done every 10 years, more often if there is a risk, if there's higher risk or symptoms. Visual screening annually, hearing annually, depression screen. They do those on admit to a nursing home. Maybe do a family violence screen, but always ask them when they're alone. Do not ask them in front of family members. Obviously, the physical exam every year, the flu vaccine every year, the pneumonia vaccine, the 23 and 13, the single dose of the zoster vaccine, and the tetanus booster every 10 years. That's all for older adults. So I think we are getting into diet now. Body mass index is the most, my words are gone because I'm not 100% here. Most reliable determination of when you compare a person's weight to height, so what their healthy fat stores would be. The classifications, know these. Anything under 18.5 is underweight. 18.5 to 24.9 is normal. Obesity or overweight is 25 to 29.9. Obesity is anywhere in the 30s, so 30.0 to 39.9. And extreme obesity is anything over 40. So kind of make this a little bit easier for you. Obese is in the 30s. Extreme obesity is greater than 40. Normal is 18.5 to 24.9. So then just remember underweight is below normal and overweight is above normal. Kind of makes it a little bit easier to remember. Nursing diagnoses that you might see are imbalanced nutrition, more than body requirements or less than body requirements, depending if they're underweight or overweight. So African American diets. African American culture, they feel that, or they give gifts of food commonly, and that these gifts should not be rejected. The person giving them will feel bad. They view being overweight as a positive thing because their diets are generally high in fat, cholesterol, and sodium, which actually makes you gain weight. So they view that being overweight, you're able to afford a good diet. Arabs, they use a lot of spices and herbs when they're preparing their food. They have bread at every meal. They do not eat any pork. All food is eaten with the right hand because remember the left hand is used for dirty procedures such as wiping their bottom. And they drink their beverages at the end of the meal. They don't drink in between like we do. Chinese, their foods are served in a specific order. They may not want ice in their drink, the traditional older Chinese. Their foods basically balance out yin and yang so that they don't get heartburn or indigestion. They use soy sauce instead of salt. And then it just kind of depends on the region they're in for the official traditional diet for that group. Jewish, they're another group that don't eat pork. They believe the kosher way, so all blood must be drained from the meat. There's dietary laws that tell them how they can kill, prepare, and eat foods. Always, always, always wash hands before eating. And they never eat meat and animal milk at the same time. Sorry, I'm chewing on a cough drop and I have a stuffy nose, so it sounds terrible. I'm sorry. Mexican, their staple foods are rice, beans, and tortillas. They're another group that feel that the larger body size is a positive. It's a good thing. Their main meal is the noon meal, and they choose their foods based on a hot and cold theory. Like if they're sick with a hot illness, they'll eat cold foods, and if they're sick with a cold illness, they'll eat hot foods. And they drink a lot of sweet fruit drinks. Navajo, all their ceremonies and rites of passages are celebrated with food, kind of like we do here. Their herbs are more of a medicinal practice rather than used in their food. Their major source of meat is a sheep, and their major source of vegetables is squash and corn. Up in Bailey's room. I wouldn't allow her to be in here. Alright. So, nutritional variations based on the ages. So, the first age is the birth to a year, the neonates to a year. All their nutritional values they get from breast milk or formula. Can you shut the door, Gage? Semi-solid food is added when these babes are 4 to 6 months old, when they can sit up by themselves or with support in like a bumbo chair. I don't know if they still have those around. I guess I had them for my kids. And I think they deemed them unsafe, but you know, my kids lived. They can hold a spoon. They have they have a different tongue thrust so that they can determine the difference between a liquid and a solid. And like I just said, they can understand the texture and learn how to swallow these semi-solids. And they're able to turn away when they're full. Sometimes you've heard they just eat and eat and eat and they don't stop. These babies at 4 to 6 months old that are starting with the semi-solid foods, they'll be able to, once they've had enough, they just won't take anymore. Honey should not be given to any kid under the age of 1, because it might actually contain Clostridium botulinum. This is a big source of infection and can actually cause death in an infant. Gives the infant botulism. Bottle mouth syndrome can happen in infants and toddler group, but their teeth are decayed because they go to bed with a bottle of sweet liquid, which may be milk. There's a lot of sugar in milk, and that milk sits on their teeth. So when somebody props the bottle and the baby lays down and falls asleep, that bottle is still sitting in their mouth when they're sleeping, so that it's kind of dripping, and they're not awake to suck it out, so that milk is just sitting there. So what we need to do is really teach our parents to not prop the bottle If the baby wants a bottle when going to bed, maybe feed them their milk and then give them a bottle of water or a pacifier to go to bed. So feed them their milk while you're holding them while they're sitting up and awake so they can get rid of all that milk in their mouth, and then give them a bottle of water if they need something to suck on or a pacifier to go to bed. Toddlers, they're learning how to adjust to 3 meals a day, so the baby may eat every 2 hours, every 3 hours, every 4 hours, just kind of depends on as they age. They're still going to need help with their glasses and their cups, but they can really start using the sippy cups. My daughter's 7, and I still make her use a sippy cup half the time. The toddler is going to, or may have, what's called physiologic anorexia. So when they're an infant, their growth rate is crazy high. Once they hit the toddler stage, they're actually going to slow way down. So it's actually, they may appear in a day that they're not eating, but if you teach the parents to look at what they're eating over a week, they'll meet their nutritional requirements. Kids are not going to, their bodies will know when they need to eat and when they don't need to. My cousin's daughter, like I said, I don't know, I told somebody that I had her this coming weekend. So we had her last weekend, and all I could get her to eat from Friday when I left clinical, so Friday at 3:30 to Sunday at 6:30 at night, I got her to eat a Go-Gurt and 2 chicken nuggets from McDonald's. I did find out that she will drink chocolate milk, but that's only because if she will not eat, her mom and grandma will make her chocolate malt, and a candy bar. But that's all she ate all weekend. And I asked her all the time, "Are you hungry? Do you want something to eat?" And she knows that if she tells me something she'll eat, I'll go get it, just because I feel bad that I'm not feeding her. But she wasn't hungry. For toddlers, never use food as a reward or a punishment. Alright, into preschoolers. They're going to be eating all adult foods. They become more active, so they require more snacks in between meals, because if they, like say they're at school, they may rush through eating because they want to get out to recess to play with their friends. So it's better that they have the snacks that they can have during school and after school. This group's funny food thing is that they only eat a certain food for a while. And it's like I said, kids are not going to starve themselves. And I've seen it so many times. A friend of mine's son would only eat cheese pizza for literally, I think it was 7 months. It was 6 or 7 months. But that is the only thing he would eat, and the only thing he would drink is Pediasure. So every meal, pizza and Pediasure. And he got over it. He lived. He's, I don't know, 8 now. But what we can teach our parents is that when they're going through these food jags, give them their pizza and Pedialyte or Pediasure, and then give them another choice. Sometimes they'll nibble on the other choice and they'll give them a little bit more nutrients, but if they don't, hey, it's there. They can, eventually they might try it. School-age kids, 3 meals a day, 1 or 2 nutritious snacks throughout the day, 1 in the morning, 1 in, maybe they get a break at school at, I don't know, 9, 10, and then once they get home from school. For this age group, the most important meal is breakfast. As they're growing, they're using more nutrients, and school becomes it's physically and mentally demanding for these kids. So making sure that they have a protein, well-balanced, good breakfast before they head off to school is a really good practice to get into. They're more focused and more able to participate in things. Obesity might become or is common in this group. A lot of times, if you're obese as a child, it contributes to being an obese as an adult. There can be a lot of, I'm sorry, I'm tripping over my words. There's a lot of decreased physical activity with this group, and like I've said, the biggest problem with this one is video games and cell phones. And I'm not saying I'm perfect because my son just spent 4 hours on his Xbox today while I try to get caught up on some work stuff. So I'm guilty too, but we're actually trying to get him to gain weight, so hopefully it doesn't work though. So our treatment for the obesity in the kids, trying to get them to slow down their weight gain, and kind of make sure that when they are gaining weight, it's in good comparison to their height. Some of these kids might need counseling. I don't know. All right, adolescents. Teenagers have very active lives and very irregular eating patterns. They eat when they can, how they can, wherever they can. Just because they are so busy. I wouldn't want to be a teenager nowadays. Milk intake, quarter milk a day is the recommendation, so that they're taking in 1,200 to 1,500 milligrams of calcium a day. They're growing, their bones are developing, they really need this calcium, especially when they're running around doing so many things. A lot of adolescents require more than the required 2,000 calorie diet. If you look at especially boys in sports, they might actually need up to 3,000 calories a day. If you consider that they might be weightlifting in gym class, and then they spend from 3:30 to 5:30 in football practice, and then have something else going on after that, they actually may need a lot more calories than the average bear. Common eating problems for the adolescents, obesity, anorexia nervosa, where they're refusing to eat, they lose weight fast, they look like they're emaciated, or bulimia, where they're binge eating and then they're throwing up, or using laxatives to have exaggerated BM. The biggest reason these problems is because of the bullying in schools. It's really bad. If they see a kid that's being bullied because they're obese, maybe they are worried that they're overweight, and they don't want to be teased, so they're going to quit eating. Couple stories I had. One story kind of covers both the anorexia and the bulimia and the or all three of them actually. I had my daughter, who was 13 or 14 at the time, come home and say, "Mom, how important is BMI to you?" I said, "Well, depends on what setting we're using it in." And she said, "Gym class?" I said, "Not important at all." "Why?" And her gym teacher at the time was going to have these kids measure their height, measure their weight, calculate their BMI, and then tell him in front of everybody else. And then he wasn't doing it to have everybody else know everybody else's BMI, but just because they were all doing it at the same time, and he was just going to have people call out their numbers as they got them so that he could write it down. Being a male, he didn't understand that this is not a good deal, and this is not a good thing. So we had girls that were, I wouldn't even say none of them were really overweight. Some of them, I guess some of them were bigger girls, but they didn't have to be bigger girls, but they weren't eating. they weren't, they would eat and then they would make themselves throw up, all for a week. And Maddie told me about this probably 3 days before they were scheduled to do their height, their weight, and their BMI. And I've known her, we've lived in the same town since I was born, and my kids have gone to the same school, and I know everybody. So she was telling me, well, this one's doing this and this one's doing that. I was kind of the jerk parent. I was looking out more for the kids, but I was really not nice to the gym teacher. But since then, they have quit doing any BMIs at all. They're not even allowed to. They can discuss them and tell them what BMIs are, but they cannot have kids do their height, their weight, and calculate their BMI anymore. Just because of the anorexia and the bulimia that was going on. It was terrible. And then another reason that like anorexia is such a problem for adolescents. I took care of a young lady. I don't remember if she was young. I don't know, 17, 18, 19 maybe. Young. But she was, I don't know, my height. But she was literally like 80 pounds. She was really, really tiny. And at that time, I was bigger than I am now. Wait a minute, let me do the math. Yeah, I was bigger than I am now by maybe like 10 pounds. So I was maybe 120 pounds. Not small, not big, but she would literally look at me at 120 pounds and her at 80 pounds and say, how do you look so good? And I was like, what are you talking about? She's like, you're so small. I was like, no, really, I'm not, honey. I said, but what do you mean? And she said something to the effect of, when I look at you, I see that your body shape is perfect. When I look at me, I see that I'm too big. And I was at the point where I could joke around with her, and I would literally ask her, what are you talking about, the rolls in your belly when you scrunch all up in a little ball? But she said, no, I seriously see myself as fat, and I see you as, the perfect weight. So you do realize I'm like 40 pounds bigger than you, right? She's like, yeah, but it's just the way I look at things. Like, you're perfect weight, and I'm large for what I should be. So it can be a very heartbreaking illness. All right, enough of that one. Nutritional variations. Young adults, females in this age group, the biggest thing they need is iron. Due to having their periods, they're at high risk for anemia. Sometimes they might need a supplement of like 18 milligrams a day, or we can teach them to eat iron-rich foods like organ meats, which you couldn't get me to eat liver or kidneys. But you can encourage them to eat eggs or fish or poultry. Green leafy vegetables have a lot of iron, or even dried fruits. If they are maybe taking a supplement, encourage them to take or to have a good intake of vitamin C, because the vitamin C will help them absorb that iron. Middle adults, have them continue a healthy diet. They need more protein and more calcium, because remember, these are the 40 to 65. They're going to hit menopause, and then it's going to eat all their calcium, so their bones are they're going to get osteoporosis after menopause. So the more calcium they can have built up in the body, the stronger the bones are, the less likely they're going to have issues related to osteoporosis. I just covered the next topic. So we really just want to teach them to have high calcium and high vitamin D levels. Middle adults may actually have weight gain because they're still eating what they normally do, but they need less calories, but they're still eating. Say they need 1,500 calories a day, they're still eating 2,000. their metabolism is slowing down, they're not as physically active. So you can see all these factors that say, hey, you should really decrease the calories you're taking in, but they don't realize it and continue to eat the same amount, and they're going to gain weight. Middle adults that are overweight are at risk for diabetes, hypertension, arthritis, or mobility issues. This group may actually report more heartburn, more belching, just because their gastric juices and free acid are decreased. So just teach them how to avoid foods that disagree with them. Don't eat tacos or spicy foods. Older adults, again, they require the same dietary as before, but maybe need to decrease the number of calories. Their group has a lower physical activity level and less energy expenditure. So we can encourage them to have a higher amount of carbs and fiber for bulk, because anybody that's in their 80s or 90s is bowel focused on their bowels. I had a lady who literally kept a diary of her bowel movements. She was 96 and doing very well, so I shouldn't complain. And she was an amazing lady. I love her. But she would write down every time she had a bowel movement. Older adults may have more problem eating because of dysphagia starts to set in. They may have tooth loss, and they don't have such a great smell or a sense of taste anymore, so they just don't smell food and be like, ooh, I'm hungry. Food pyramid. This is just kind of a tool used to guide people making their daily food choices. It's like I said, it's a guide. It's not a definite. The food pyramid used to be stacked like blocks, and the more you needed of a food group, the bigger the box would be. That's how it got to be a pyramid, because like the sugars and the sweets were up on top, and you just needed very little, so it was just a little triangle. They changed it now so that it's drawn from the bottom up, and each section has their own sliver, because they want to really stress that not only do people need good nutrition, but they also need activity. They can engage in some of that, stuff that they always said is bad, but only in moderation. Food pyramid, they can personalize it. They can proportion it to what they need. Gives them a little bit of variety. And My Plate is kind of the same idea. They use the picture of the plate to determine what their dietary guidelines are. Not a guarantee that they're going to get every nutrient, but it will kind of help people come close to what they need. Personalized to every person. An elderly woman is not going to be able to eat the same thing as a teenage boy. A lot of the times these little old ladies nowadays, they eat like birds. They become full faster because they eat so little that their stomachs have shrunk. Malnutrition. Undernutrition, just they're not getting enough nutrients to meet their daily requirements. Overnutrition, their calories they're getting too many nutrients because their calories they're taking in exceed what they need. So it just kind of goes and turns itself into adipose tissue. Signs of inadequate nutrition. You're going to see weight loss. These people are going to be weaker than normal. They're not going to be able to function as well as others. They're going to have delayed wound healing. Their protein levels are going to be low, and that's what really is needed to help the person heal their wounds. So obviously their wounds are going to take longer to heal. They're going to have more infections because they don't have anything to fight them off because their immune response is so decreased. Their respiratory function might be impaired. They're going to be in the hospital longer. You're going to see their hair, any part of their thing their body when you look at them, they're going to be pale, they're going to be dried out. So they're going to have brittle hair, they're going to have dry skin, they're going to have flaccid muscles. Their tongues might be white, their lips might be cracked. Tongues are might be kind of swollen as well. So protein, calorie, malnutrition. Basically, when a person is malnourished or undernourished, the carbs that they have stored in their body to make glycogen are actually used. But they can only your body can only use the glycogen for 24 hours. There's only enough stores for 24 hours. Once this 24 hours is up, the body is going to start using the protein that's in the body. So people who have a very low intake of calories, they're going to see a huge problem with this. As the nurse, when you're assessing, you're going to see a low albumin blood level. You're going to see weight loss. You're going to see muscle and fat wasting. It's really kind of a terrible sight. Nutritional assessment. We want to get a nursing history. We can ask questions. We're going to need to get the anthropometric measurements. Basically, as you recall, these are just non-invasive techniques to look at the body. It might be skin fold measurement, might be mid-arm circumference or mid-arm muscle area. You've seen these tools that they use. Biochemical data. So the labs that we look at for nutritional purposes. One of the most important is the proteins. Albumin, it's the most common one that is looked for. A low albumin level just indicates a prolonged protein depletion. The albumin is not the acute, but it's the longer term one. So it won't show up as low within like the first 24 hours. To give you an idea of how important albumin is, when my brother was in his accident, he was in an accident on Monday, and on Saturday I came and they were doing nothing. He was basically sitting in his room with IV fluids going. He didn't have a PCA pump at all, and we were just waiting for him to have a bowel movement. That was our plan. I think he had a chest tube at that time. I don't think it wasn't pulled yet. He had an NG dissection. He had an NG because he got that on the Wednesday. Anyways, he was NPO because the trauma in his pelvis they thought had damaged anything in his, any of his bowels or his stomach, because his pelvis was actually broken in half and it twisted. So anyways, I get there on Saturday and they're still just giving him fluids and watching him. And so I asked the provider, I said, well, what are we looking at? I mean, are we going to be starting any TPN or lipids or anything like that? He's like, no, I don't start them for 5 to 7 days. And I said, well, today is day 6, so can we talk about them? And he's like, well, I don't want to consider them yet. Okay. Behave, Lisa. I said, so if you're not going to start TPN or any lipids or any type of nutritional supplement because all he's eating is ice chips, can you tell me what his albumin level is. And the doctor looked at me and says, well, we haven't done one since discharge. My response was, I really don't care what his protein was on discharge, or on admit. I want to know now. He's like, well, no, we haven't. Got back Sunday morning. TPN was hooked up. His albumin level was 2.8. Supposed to be 3.5 to 5. So it wasn't seriously low, but it was low enough that he needed something. But anytime that somebody's looking at malnutrition, the albumin level is always drawn. Transferrin or TIBC it responds quickly, meaning it might show decrease more in the acute stages, the right away type things. Prealbumin. This is the one that is like acutely or shows a decrease quicker. Normal levels are 15 to 35. Anything below 15 is a risk, and below 11 they need something done now. They might look at urea nitrogen, which is kind of like a bun, but it's taken from a urinary sample, and urinary creatinine, so that they can see what the kidneys are doing with the protein. Total lymph count, they might look at that, the white blood cell count, because malnourished people are going to have a decreased immune response. Remember? Alright. Clinical data or during the physical examination, really focus on proliferating tissues. What I mean by that is like skin that it'll die off and then it'll come back. They produce new hair, nails around the eyes, and the mucosa. So when we were assessing people that might be at risk for malnutrition, their general appearance, they're going to be apathetic. And remember, apathetic means loss of interest or no interest in something, not sympathetic or empathetic. They're going to tire easily. They're going to be more fatigued. They're going to be lethargic. They're going to be overweight or underweight if they're if their intake is higher than their requirements. Their skin, you're going to see dry, flaky, scaly. You're not going to see any sub-Q fat. Their nails, they're going to be brittle, pale. They're actually going to be ridged, and they might be spoon-shaped. Their hair, dry, dull. It might be thinning, brittle, breaking off. Their eyes, their conjunctiva. This might be pale or it might be bright red. And then an FYI here, if somebody's deficient in vitamin A, they're actually going to have night blindness. Their lips might be swollen, red, cracked, and actually have fissures in them from being so dry. Their tongues are going to be swollen and red, and it's going to have like a more of a smooth appearance. Gums might be spongy, inflamed. They might bleed easy, like when they brush their teeth. Muscles are going to be flaccid, wasted, soft, underdeveloped. In the GI system, you might see the anorexia, the bulimia. They might have more heartburn. They might have diarrhea or constipation. Their bellies are going to be protruding, like the commercials that say, please support our children, give $12 a day and you can give them the world. But we're going to take $11.85 of it. But the pictures of those little guys are heartbreaking because they're standing there and their bellies are just sticking out, and it's not because they're full of food, it's because they're hungry. Nervous system, their reflexes are going to be decreased. They might not feel as well, hear as well. They might have paresthesia, where they're having the burning, the tingling of their hands and their feet. They're going to be confused. They might be irritable. Kind of like a hangry thing, but worse. And then further in the assessment, we're going to collect some dietary data. Whether their eating patterns, their habits, their food preferences, what are they allergic to, intolerant to, just kind of get an idea of what their overall food preference, what they do. Might ask them to do a 24-hour food recall, where they sit down and write all the foods and beverages that they ate in the last 24 hours. They might do a food frequency record, so they list all the food groups and they just check when they have that type of food group and write how much. Food diary, they're just going to write everything they have. I ate half a cup of green beans. I ate, 2 cups of yogurt. I'm trying to think of healthy foods. I'm not real good at it. But they're just going to write down everything they ate for like maybe it might be a 2-week food diary. And some people might be doing that for your health promotion plan. If they are, trying to lose weight or whatever they might be. Their diet history. The dietitian usually does this and then takes all of the information that we have gathered and actually uses that to make their assessment as well. Food safety. Remember to always wash your hands and the surfaces frequently. Do not cross-contaminate foods, meaning don't cut your chicken on the cutting board and then cut your celery when you're making chicken noodle soup. I actually thought of this last night when I was making chicken noodle soup. And I cut my celery first, and then I cut my chicken. Make sure you're cooking meats and stuff to the proper temperature so that things are not raw. And then if you have any leftovers, make sure they get put in the fridge right away and thaw stuff from the freezer in the fridge and used right away after they are thawed. So that's dietary. On to family. And I know I just gave you guys this lecture last night, but might as well go over it again. Family. It's just 2 or more people that are joined by marriage, birth, or adoption. A lot of people consider like an unofficial adoption, like their friends, oh, they adopted me, this is my mom, this is my dad. And I don't know, I consider that as well. Basically, they live together in the same household. Their bond is produced on like they're emotionally close. They share things and feelings and ideas, and they support each other. They all have a common set of values that they share. A family is considered the basic unit of society. Every family has their strengths and their weaknesses. So it's kind of our job to assess a family's strengths and see what their support systems are. Like we were talking about family-centered care. We really have to be able to say, oh no, I think that they're strong in that aspect, or they're not doing so well in that aspect. So what is a family strength? Family strength is just the process, the relationships they have, and the resources that they have that they can use when they're going through an issue and need to manage their stressors. Might include resources such as their education or maybe experiences that they've had or finance. Maybe they can pay somebody to do it. Strength is effective communication, collaborative problem solving. Maybe the family's emotionally stable, or maybe they're just very resilient. Types of families. I'm trying to get this all the way up so I can look at it. We're not quite to the bottom of it, but the nuclear or the traditional family. Kids are living with their biological mom and their biological dad. That's it. If you are having a hard time with this one, just think June Cleaver and her family. The Beaver, I can't think of any one. Go back to like the 50s where they everybody had mom, dad, and it was the kids living there, and that's it. The dual career or the dual earner families, both mom and dad are employed. They're both bringing home money, but they may or may not have children. I have a habit of saying mom and dad all the time for the families, but husband and wife are both employed, both bring home money, but they may or may not have children. Extended family or intergenerational family. There's the mom and their dad and the dad. Sorry, my throat is killing me, and I've been talking a lot. But they share raising the child with their parents, their siblings, or maybe their aunt. Could be, maybe just one parent. The child and the grandparent. That would be an intergenerational family. But it's like a parent or a sibling or another relative will live with these people to help raise the family. I've seen this common in the Hmong population when I did home health. They had grandma, mom, dad. No, they had great grandma, mom and dad, their children, some of whom were older and adults, and then they had children. So it was 1, 2, 3, 4, 5 generations, I think. Something like that. All living in the same house, which was kind of neat to see. Child-free families. They have no kids. They're either infertile and can't have kids and choose not to adopt, or they just choose not to have children. I know a lot of families or a lot of people like that. Single-parent family. One parent might be widowed, separated, divorced, abandoned. This type of family has the highest stress level because if you remember, that parent is both mom and dad. So sometimes they have trouble finding childcare because they can't go to work and leave the kid with their significant other. Maybe they don't have family in the area. Financial concerns are always a terrible, terrible topic for single parents. Their roles can actually overlap. Like I said, they're both mom and dad. And, it can be very difficult. They can be very fatigued. They can be socially isolated. Like I said in the lecture for this, I was a single mom, and my hat goes out to anybody who is a single parent, just because it is a very, very stressful situation. I don't know that I'd be who I am today had I not been a single parent. But these people, they're generally very, very independent. They may be, what's the word I want? Very motivated. I have had a couple students come through, and I actually have one right now that I am so proud of. I believe she is a single mom, and she's doing amazing. So it's not always a bad thing when you hear single parents. Please get that out of your head because some of these single parents go on and they do amazing things. Alright, there's my spiel on single parents. Single mother by choice family. It's an unmarried woman. She either chooses to artificially conceive. She could actually, naturally conceive. Or adopt and not have a life partner. When I worked in psych, there was a doctor that had adopted 2 girls. I don't remember the exact country they were adopted from, but they were Asian. And she did amazing with them. Those girls are amazing. They're doing very well. The blended family or the reconstituted nuclear or the step family. There's 2 parents. Each parent has kids from a previous relationship. And these parents and these kids, the parents might be married, but everybody lives together. This is the hardest family to get used to. It can be a very difficult situation. The binuclear family, this is post-divorce. Both parents are remarried, so mom 1 and dad 1 are divorced. Mom 1 marries dad 2. I guess they don't even have to be. Yeah, they have kids. And then dad 1 marries mom 2, and then they co-parent. They help each other out. So if you can see, the nuclear family is the mom, dad, and kids. So the binuclear family is just kind of a branch of 2 mom, dad, and kids. If that makes any sense. Heterosexual cohabiting family. This covers so many of the families. It's a heterosexual couple with or without children that live together. Gay lesbian families. Oh my, we still have a lot. They're a homosexual couple living together with or without children. 2 moms, 2 dads. Maybe a single parent. Now it's more common for adoption and having kids because they get the domestic partner policy, so that they get insurance and all of that, which I think is an awesome thing. Adolescent families, these are the teen parents. These kids are not prepared developmentally, physically, emotionally, or financially, but somehow they make it through. I've seen adolescent single parent families grow up to be just a wonderful, wonderful, wonderful people. Example, my best friend had her son at 14. Yeah, at 14. She raised him all through high school. Mom babysat, but she got a job. She paid for all of his stuff. No help. And she went to college, and now she has her master's in social work, I believe. I don't know the exact term, but she actually has a very good job, and he has graduated high school, is in the Marines, and he is considering going for nursing. So, there can be good tales coming out of adolescent families. There can also be some bad tales as well. But I like to focus on the good ones. Foster families. This is just a temporary family placement. If a child's unable to live in their biological parent's home, whether it's abuse or if there's drug abuse, just basically the court has deemed that it's not safe for them to live in the home with their biological parents. Cohabiting or communal families. These are people that are unrelated. Could be persons or families that live in the same spot, whether they're testing a relationship or if they're going to share expenses. Maybe there's a couple families that live together because rent is so high that they're just sharing a house, renting it. Single adults living alone, young adults, older adults, it doesn't matter. Generally, you're going to see more, like I said, I read that wrong, sorry. Young adults and older adults are the most common groups to be living alone. Young adults, they haven't gotten married yet and settled down. Older adults, they've lost their significant other, their spouse, so they're more common to be living alone. Sometimes people choose to live alone. Some people, after they're divorced, live alone. Or like I said, they're widowed and they live alone, and the older adults. Sorry, I'm trying to play with my other mouse. Ah! I do not like this computer. My computer actually crashed again last night, and it would not work. So I'm just happy that I could get it up running enough to do this. Where's Duvall's? Alright, Duvall, Miller and Duvall stages of life, stages of family life. Stage 1, this is where the people are establishing a home, establishing a family. It's a newly married couple. Their job is to establish that relationship. Maybe they're starting to do reproductive planning. They're planning on kids. They're not planning on kids. They are setting up their home, those types of things. Stage 2, they have now become the childbearing family. Their oldest child is anywhere from birth to 30 months old. Remember I said oldest child, 30 months up to 30 months old. And you know, at this point they may have two under, what is that, almost 3, 2.5. Yeah, 2.5. So sometimes they have, you know, they may have one who is 29 months and they may have one who is, you know, 18. But go by the oldest child. So our role as a nurse, we just really need to educate them, talk to them about what risk these kids are at. Sorry, I'm going to go up. And what they're going to be going through at growth-wise. Stage 3, the oldest kid is 2.5 to 6 years old. That's basically the preschool stage. Can be a very busy family, and they're going to have a lot of growth and development needs for education. They're going to need to learn how to foster their learning at this stage. Stage 4, these kids are growing up, and they are now 6 to 13 years old, basically the school age portion of it. Things that we really need to teach parents when they're in this age. Kids need to have all their immunizations, making sure they're getting their dental checkups. Talk to them about safety and all the issues that occur with kiddos. Have them talk to their parent, try and get their parents to talk to them about what they're experiencing at school, because their safety is the highest priority in the school age. Whether they're out playing or they are curious and experimenting with lighters or, whatever it may be. Stage 5, their oldest kid is 13 to 20. It's the teenage family life. Remember I said this was probably one of the most trying stages, but the only reason that this is the most trying stage is because moms and dads have to go through this trying stage to start to separate and allow them to grow up. Once they get out of the house and get kind of, what the heck, situated a little bit more, they're not quite so naughty. They're not quite so naughty as they were when they were teenagers, so it's easy to love them again. You might just be frustrated at them when they first move out. Stage 6, these families are launching young adults. They're 18 and moving out. They're either going to college or going out and getting their own apartments, starting their new long-term careers. Parents are still there for advice or guideposts or to help or whatever these kiddos need, but they are going out and establishing their own houses, their own households. Middle-aged parents, this starts an empty nest when all the kids are out of the house through the time that they retire. During this time, they're returning to a 2-parent nuclear unit, and that empty nest syndrome where they're sad because they don't have any more kids in the house will eventually go away, and that leaves to more time for travel, for hobbies, to spend time with each other. That's what I tell my husband. I said, once the kids are all out of the house, I'll have time to date you. Because we both, when we got married, we had my 3, his 1, his step, daughter, and one of ours. So I think there was 6 total. So it's kind of like a Brady Bunch. Stage 8 is the older age parents, and this is just anywhere from retirement to the death of both parents. Alright, the family systems theory. Families are always interacting and influenced by these other systems, whether it's church or school, or, I don't know, work. So the systems theory says that the family needs to protect each other and set boundaries so that these other systems aren't interacting too much with each of the family members or the family system. And there's too much responsibility or too much activity, and these family members are being overwhelmed and burnt out. They're becoming exhausted. So basically, it's to protect them from the demands or the influences of the other systems. If that makes any sense. If it doesn't make sense, I know what I'm trying to say, but I can't get it. So if you have any questions, let me know. The structural functional theory, it's really not a huge deal, but the structural portion of it focuses on the memberships and the relationships among the members, like the mother, daughter, brother, sister type thing, the father, son. But the functional portion of it focuses on basically the intra-family relationships that are of the family system. So maybe those other systems. Family assessment. I'm going to try and scroll my page down again. Just a collection of data that goes over what type of family it is, what their support system is, their sociocultural background, and any needs that they might have. Okay, so family assessment. It includes information about each family member, what the type of family is, what the person's roles are, kind of the idea that you guys are doing on the family dynamics assignment. If they have any cultural practices or religious practices, what's their support network, and how do they communicate? Some families are very good at communicating, and some are very bad at communicating. I always say that my family has a wonderful communication process because you can tell one person, and in 5 minutes, the entire family, extended family, and their friends and everybody else knows. That's kind of how the family on my mom's side works. We tell one person, and that one person will make sure to get it out to everyone. And within 10 minutes, I swear everybody has been called and told and updated. And yeah, I think within 10 minutes of finding out about my brother's accident, I had aunts and uncles calling me, asking me what's going on. I'm like, I don't know, I haven't even been up there yet. Family assessment will determine the family structure, really gives insight to what their support system is, what they might need, determines what their functioning level is, their strengths, their weaknesses, their health statuses, their cultural influences, so that you can better care for them. Maybe they're Jehovah's Witnesses and none of the groups accept blood. Or maybe they have a different, I know some of the different cultures have for the elders, they really, really respect them and they take care of them. Like the Amish. I've had one Amish in the nursing home, but generally they keep their elders at home and they care for them at home. The one Amish I did have was only because his wife had tried to poison him not once, not twice, but 3 times, and they finally said, I don't care what our beliefs are, we're taking him to a nursing home to get him better. So he had been in the hospital for something. And yeah, it was a weird situation. Kind of gave me a huge kick in the pants of culture and family dynamics all in one. The genogram, make sure you know the definition of this. This is just the, it helps, it goes over the relationship of the family members. Kind of depicts the chronic conditions that are present in the family unit. And it also has the gender and the lines of birth descent. So it looks kind of like a family tree to me. But alongside, like, mine would look like, have my mom and dad up at the top and have COPD, emphysema, lung cancer, whatever, listed cardiac issues, whatever, like the huge long laundry list underneath my dad. And then it would break off to, my brothers and then me. And then each of us has our own thing that we have, issues we have. So that would be listed under each one of us. And then it would break down to our children. And you guys all know that my children, I swear I could take you guys to clinical at my house. It would break down into POTS and seizures and mast cell and mood dysregulation disorder. It's not autism, but it's on the spectrum. Anyways, it gives you kind of an idea of the relationship of the whole family members and what they go through, what conditions they have. The eco map is more of like a concept map of the family, their relationships, and their social networks. It's more of a thing to see what their support systems are. Oh my goodness, we're almost done. Family in crisis. Remember that the illness of one family member affects the entire family. The roles and the responsibilities that that family member has is now the responsibility of someone else. So say mom takes kids to school every morning. Well, now mom's sick. Dad's going to have to take the kids to school. They may have anxiety. I can't talk. Because they're concerned about their sick family member. There's more tasks they need to complete, less time to complete them because they're running back and forth to the hospital. And when they ask for help, consider this a strength and not a weakness, because it's very hard to ask for help in that situation. I just ask that when you guys do take care of somebody who has that family, just take a step back, take a breather, and just remember that they're going through a lot. I will tell you that I am that family member, and I will apologize when in advance. But like when my dad had, I don't know, a second or third stroke, I was the one after a stroke, they sent up a pork chop for him to eat. And yeah, I was the one that walked up through the tray on the table and said, how the hell would you like him to eat that? But I was going through a lot. I'm the youngest and the only girl, so me and my dad were very close, and I was a little ornery. So just take a minute, take a step back, take a breather, and say, yeah, well, they're stressed out. I will tell you that I was literally in Bailey's charges listed that mother became angry because she did not get the answer she wanted. And there is something in there about me being irrational. But yes, I was. I'm not going to lie. Actually, I don't think I was irrational. I think I was just loud. Anyways, nursing diagnosis. Things that you may see are caregiver role strain, disabled family coping, dysfunctional family processes, impaired home maintenance, impaired parenting, interrupted family processes, or ready for enhanced family coping. There's a lot of issues on how the family functions. So I think that's it. I've done a lot of talking and tried to give a lot of examples, and some of them a lot of personal, but I really feel like some of the examples, or when somebody gives examples, it sticks a little bit better rather than just reading what's on this review sheet. So if you guys have any questions, I will just email me, text me, whatever, and we will get them answered for you. Good luck studying for this exam, and I will see some of you on Thursday, and I guess I'll just see you guys virtually online. All right, have a good one, guys.